Close your eyes for a moment and imagine growing up in a neighborhood where you may not live long enough to reach retirement age. Now imagine that within walking distance, growing up in a neighborhood where you may not only live long enough to reach retirement, but you may outlive the average American by 5 years. Hi, my name is Brian Sims, president of the Greater Baltimore Health Improvement Initiative. In Baltimore City, there's an almost 20-year gap in life expectancy between neighboring communities, a disparity that is particularly glaring along racial and economic lines. For too long, health outcomes for people of color have lagged their white counterparts. Even when adjusting for socioeconomic factors, people of color still fare worse. These disparities will continue to persist without efforts to ensure a more culturally responsive approach to healthcare. However, decisions to prioritize these efforts come from the top. They say to bloom where you're planted. Well, we know healthcare and we know leadership. Drawing from our decades of experience in healthcare policy and management, we seek to use our expertise and extensive network to develop and mentor aspiring healthcare leaders of color from local colleges and universities through our Pipeline for Future Healthcare Leaders program. Not only will our pipeline increase representation in the healthcare field for both clinical and non-clinical leadership positions, which we know is correlated with improved health outcomes, but it will also create more pathways to economic advancement, helping to stabilize our communities and ensure a higher quality of life. Our vision for Baltimore is that it become a city where the life expectancy of all of its residents, regardless of neighborhood, is reflective of the most economically developed countries in the world, where opportunity, trust, access, and cultural awareness intersect, achieving health equity for all. Now, we believe future healthcare leaders of color are the change makers needed in Baltimore, and we hope you do too.